see you again. Really, I'm keen on finding out a number of things. That's why today I've come here. And when I see you doing all of these things with the plants, I begin to ask myself, why is it that she didn't find anything doing with her life? Why focus on plants? What is it with plants?
So basically my life goal is to find a cure for epilepsy.
Epilepsy?
Yes.
Okay.
So epilepsy is a condition that affects the brain.
Why epilepsy? Of all the things that you could find a cure for, HIV for instance, you make millions, cancer, you make several billions. Why epilepsy?
Okay, so I zoned into epilepsy mainly because of my interaction with epileptic patients in the hospital.
Right.
Yes, as you know, I'm a pharmacist.
Yeah.
Yes, so in my clinical work, I have come across a lot of people who are suffering from epilepsy. And the special thing about epilepsy is that it has no cure. So it got me thinking that patients who suffer from epilepsy have to live their whole life with the condition without any hope at all that maybe someday they are going to be free of the condition. Yes. So based on the skills I have, I just thought that it was one way I could contribute to society. Yes.
Right. Interesting. So how far have you come in that process? Are you getting any closer to finding that cure?
Yes, so I have worked on quite a number of plants, yes, because plants tend to contain a lot of substances that have the potential to be medicines.
Right.
Yes. So in my line of work, we screen a lot of plants. I've worked on hundreds of plants. But the thing about drug development is it actually takes quite some time, an average of 10 years. Yes. So we have come quite far in identifying some of these substances that have the potential to be medicines. Yes.
Right.
So the next step is actually to do what we term formulation. That is, we'll make them into suitable medicines and then test them in humans.
Interesting. Let's go back a bit and take a look at you starting life, thinking of what you could become in future. And while several people would, I remember when I was a kid, I said, I'll be a pilot. And then I grew up, I went to the secondary school, they said geography. I failed. So I realized, no, this is not my field. Mathematics, I failed. I wasn't very good there. So for you, is it the case that all through the process, your mind was on me trying to do something to cure something like epilepsy? Is that what you had in mind all through the while growing up?
No. Interestingly, my story has not been too different from yours. I was a smart child, I wouldn't lie. So
you were smart, then you are different from me.
I was a smart child, so you know in our society,
right.
Everybody says you have to be a medical doctor.
That's true.
Yes. But actually, there's this story I always tell. When I was a teenager, about 15, what I actually wanted to be was the president of the World Bank.
Wow.
I had no idea what he did.
But there's money involved.
Yes. I knew, yes, he looked very important when I saw him on television.
Right.
And I just felt I wanted this man's job. Yes. So even though the consensus was I have to be a medical doctor, I actually went to Wesley Girls High School as a general art student.
Wow.
Reason being, I desperately wanted to learn French. And you know the way the curriculum is.
Yeah.
Yes, you have to be an art student
exactly.
to have that opportunity.
Yeah.
So I actually started off in the arts class. But just like you, I didn't like geography. I just couldn't stand the geography. And after some time in the arts class, I just felt like this place wasn't for me. Yes. So I asked to be switched to the science class. Yes. So I actually joined the science class very late. They were far advanced. It was almost time for exams. And I had to join the science class. So I really, really had to catch up. But I did extremely well.
But this was still in the first year?
Yes, this was still in the first year, yes. I did extremely well on my exam.
Right.
Yes. In fact, I topped my chemistry paper. So I knew for a fact that science was something that came to me naturally. Yes,
right.
and it was something I had to do. Yes, and then I came to KNUST, and then I came into the pharmacy program. Yes.
I see. Okay, so for many who don't know, including myself, some years ago, I would have thought that somebody doing pharmacy, or of course you've gone to the university, you studied pharmacy, a pharmacist and the like. Some way, somehow, we happen to hear of some bank in there somewhere in the mix that you're doing something in the bank or banks even?
Yes, so I've always been interested in money. I actually have had stints in the bank. I had the opportunity to work in Stan Chart. I had the opportunity to work in EcoBank. But those experiences still didn't do it for me. Yes. So I have tried other things. I'm a pharmacist. I've done clinical pharmacy. I've done community pharmacy. Yes. But I don't quite feel at home like I do when I am in the lab.
I see. So you forget about all the money you can make in the bank and say, nah, I want to go to the lab, just go and wear some white robe and make some small money. Rather?
Well, you can still make money here if you want to. There are still avenues for you to make money. Drug development is one of the fastest way of making money.
That's true.
Yes.
That's true.
If I discover a molecule that everybody's been looking for, I would get paid money for IP rights to that molecule. Yes. So over here, it's just like any other job. You can make the money if you intend to make the money.
Take a look at some of the things you encounter on a regular when you're doing some of these. What's this, by the way? I see a lot of these things here.
This is stem back of jatofa.
In English or tree?
Okay, so you know the tree. Right. The tree is covered with material which we call the bark.
The bark,
yes. So that's hard, woody substance.
Right.
Yes. So you have some of it covering the middle part of the tree, that's the stem. You have some of it covering the base, which are the roots.
Yeah.
Yes. So depending on the information we get from the traditional medical practitioners, we take the part of the plant which they claim to have whatever activity we are looking for.
Right.
Yes. So for instance, they can tell you that the activity is in the bark that covers the stem of the tree. So this is just the bark that has been taken off from just the stem of the tree. Yes.
Okay, so is that to suggest that without these traditionalists or herbalists actually finding the exact thing a particular tree can help with maybe a bit of a challenge?
Yes, definitely. In fact, we depend on them a lot for the knowledge. Yes. So,
but they say you don't respect them.
It's dicey. We actually do, but they are very secretive. You know, a lot of them have the knowledge being passed down from generation to generation. Yes, and so everybody is sort of trying to protect their knowledge. Right. Yes, it is not true that we don't respect them. In fact, we collaborate with them a lot. We collaborate with them to the extent that we actually have a resident herbalist in the Faculty of Pharmacy. So he acts as a liaison between academia and the traditional medical practitioners. Because if I should walk to them just as me, I'll be viewed as an imposter who is trying to steal their knowledge. Yes. So we have a liaison. He is actually a traditional medical practitioner who has been employed in the university.
So what do you say, or what comes to mind when you hear some of these traditionalists you talk about the fact that, well, there's a cure for HIV, or they have a cure for cancer, they have a cure for even, and the like. Scientifically, we've not been able to prove any of these. But some say they do have it. Recently, there was something of the sort in the news about a particular product having the ability to cure HIV. I'm sure you quite remember. And all of the things that came. So when you hear some of these things, what comes to mind? Where do we even draw the line?
We can't exactly say their line. Yes, we don't have evidence either way. You don't have evidence to the fact that they are lying or they are telling the truth. that is where scientists like me come in. Our job is actually to put some validation to the claims that they make.
Right.
Yes. So, for instance, if they claim that they have something that can cure HIV, and they are willing to let us test it, we actually do test it to see whether their claims are true. So, for instance, I am interested in epilepsy. So I test a lot of the plants that they claim can cure epilepsy or can manage epilepsy. So far, with the majority of the plants I have tested, their claims are actually true. Yes.
So we could have a cure for AIDS right here in Ghana.
It is possible. The problem is the options that are available to us are so many. It is almost impossible for us to test all the plants in the country. Yes, but then it is highly possible. Yes.
Okay, let's take a look at something else, and I'm sure this will be of interest to a lot of men. You see, people go out there and they say "Mami bites," and then they have all of these concoctions mixed up in there. I have followed and heard some of your colleagues suggest that such things actually don't do anything, and it's actually a psychological thing. So some will say once you take this particular aphrodisiac, even though it may not have been tested or approved by the FDA as an aphrodisiac, they will go ahead to suggest to you it gives you the ability to do ABCD in 47 hours or something of the sort, and it gets a lot of people excited. How realistic are those claims also?
So plant medicines they're actually real. In fact, a lot of the medicines that we have, conventional medicines, have their sources coming from nature.
Okay.
Yes. So actually, when somebody makes a claim that they have this concoction that can do A, B, and C, as a pharmacist, I would advise you to be careful. Don't quickly jump at the opportunity to swallow it. Yes, because a lot of these concoctions do have substances in there that have activity once they get into your body. And the thing about plant medicines is they have a lot of components in there that do so many things. So once you swallow it, you have so many things in your body that are doing a number of things that you have no idea about. It's actually a very dangerous situation. So that is why there are scientists like me. We are trying to look at these medicines and be able to tell exactly what they do so that we can advise on how to use them safely. Yes.
So sometimes even the thing could actually work. Maybe the dosage may even be a problem. Maybe you're supposed to take 1 tablespoonful, you take 10 because you want to. So how about, again, closely linked to this, right? How about the fact that one drug, sometimes you sit in the bus or you're even driving, and then you just hear people, wait, me, yes, it can do this. And they mention about 17 sicknesses. Well, sometimes with 2 or 3 top-ups, making it 20. And they're like, is it possible for one drug to be able to cure so many ailments?
It is highly possible for one drug to have a lot of actions.
Okay.
As to whether it actually cures the ailment is something very different. So usually if you take even conventional medicines that have a very pure substances in there, usually it's just one substance in the medicine. Yes. If you test it pharmacologically, it is going to have a major effect. And usually that major effect is what we say the medicine is used for. But the truth is that even for purified conventional medicines, they do not have only one specific action. It is possible that once they get into the body, they can affect other parts of your body. That is not the primary use of the medicine. That is why when you take medicines, we say you can have things we call side effects.
Side effects, yeah.
Do you understand? You are having the side effects because you have that one substance that is doing more than one thing in your body. And like I said, with the plant medicines, because they are not purified, you have so many things in there that are doing a number of things. So it is possible that that concoction could have a major effect, but then it can have other side effects. Now, as to whether those side effects can result in the curing of a second disease, that one we would have to put science to it.
Interesting. Just like you are giving us a lot of education, but it gets me thinking. Do you even have time for yourself? Do you spend time? Do you go out? Do you have fun? Do you go to the club? Do you club?
Not as much as when I was younger.
Okay.
Yes.
When you were younger, you were a banker, so yeah, it's understandable, right?
Yes,
so,
I do.
So
I have a social life.
How do you manage it? Does this have an impact on even your personal life, your friends? Do you even have friends outside this lab?
Yes, I have friends outside this lab. I have friends outside the university. Yes. In fact, when I decide to go out, I go out a lot with my friends outside.
To the club?
The university. Yeah, sometimes we go to the club. Sometimes we just go sit down somewhere. Sometimes we go out of town. Yes, we go on road trips. And that sort of thing, yes.
Not bad. Maybe I can switch to this once journalism fails me. It's okay.
You're welcome.
Okay. So, Alice, you've spoken to us about your personal life and how you're able to go out and chill with the friends and the like. How about the husband? I mean, when you leave him and you go to work and you stay here for hours, how does he manage?
I happen to have a very wonderful husband.
Okay.
Very, very supportive. Yes. In fact, he pushes me to go for things.
Right.
And he actually is okay with me reaching for the stars. If
finding a cure for epilepsy.
Yes.
Primarily.
Primarily.
Who's he? What does he do? Because I can't allow this. So my wife will be okay. We all came to meet it. We'll go and leave it.
Okay, so my husband is called Kojo.
Right, Kojo.
Yes.
Okay. You just want to say Kojo.
Okay. Have you ever heard of the rapper Kojo Q?
Kojo Q. Oh, that's your husband?
Yes, that's my husband.
Wow. Oh, nice.
So I'm married to a rapper.
Wow.
A journalist, yes. He has a journalism degree.
No wonder you like clubbing. Okay.
You know, interestingly, he actually is more reserved than yes,
a lot of people think that's true. That's true. Oh, then I'm really, really impressed that he would be this supportive in such. Of course, it's not to suggest that ordinarily we don't want the men to be supportive. No, not at all. But I think your work would demand and require a lot more of you, and so perhaps the ordinary man will have to step up a bit in order to support the wife. And of course, in this part of the world, it's not a norm, right? So I would want to assume maybe he supports by not calling you so much that, where's the food? Or
no, he doesn't do that yet.
Okay.
Yes.
So you still come and you still cook and do all the other things you have to do? Or he does them?
Sometimes he does the cooking.
He does them?
for me, yes.
Wow.
Yes. Sometimes I get home and he has made me dinner.
Okay.
Yes.
He has tried, but
Yes.
the food isn't nice at all.
Oh, excellent.
Really?
Yes.
He could be a good chef.
Oh, excellent, yes.
Ah.
Yes.
And you're not saying this because he's just your husband?
Oh, no, not at all. Actually, when it comes to trying out recipes, he's more daring than I am. So he ends up stumbling on some very amazing foods, yes. Yes.
Sometimes
it's an excellent scoop.
I think can cause
We haven't had that experience
yet.
Yes, I'll let you know.
Okay, so I mean, that was just by the way though, but back to one of the things that usually a lot of people talk about when it comes to plant medicine and the like. The view is that successive governments have not been very supportive in that direction, as in making funds available, pushing people in that direction, even logistics, and all of that. What would you say is the current state? Do you people get the necessary support in doing some of these researches?
No. That's the truth. African governments in general are not very supportive when it comes to research. This government specifically was quite promising in the beginning because one of the first statements, very bold statements that the president made was he was going to dedicate about 1% of our GDP towards research and in setting up the National Research Fund. In fact, we were all very excited because if you look at all the countries where they do advanced research, it is because there is a lot of government support.
That's true.
We don't have it in these parts, so we were very excited about it. Unfortunately, we haven't seen anything.
But the research fund is up, is it not?
You
people are enjoying book and research allowance, are you not?
I am given a research allowance of 1,500 Ghana cedis a year.
1,500?
Yes.
To do research?
To do research. I can hardly buy glassware with my 1,500 Ghana cedis. So if you give me 1,500 Ghana cedis and there's COVID and you ask me for a cure of COVID, what I also ask you is how exactly are you expecting to come?
You ask the question, are you mad? How can
come by that cure with 1,500 Ghana cedis a year?
So to do a successful research, how much would you need?
Currently, under perfect circumstances, about $1 million.
Oh no, okay, that's perfect.
Yes.
We are too imperfect to even begin to consider that. So let's say something around, say, $100,000. Would it suffice?
It can do something significant, but you can't develop a drug with a budget of $100,000.
So with you looking at epilepsy, what is the budget in mind? I mean, now you've mentioned that you've gotten some plans which are beginning to show some promise in that regard. So you're a step closer to finding that. I'm sure once maybe there's some sort of support, perhaps you can go a long way. How much are we looking at?
$5 million. So like I said, we have to test it in the lab and prove that it's working. Then we have to make it into a medicine. That's a formulation step. Then we have to do clinical trials.
Right.
Yes, clinical trials is where you test it in humans. Clinical trials are very expensive.
Yeah.
Yes. You have to recruit the people, you have to compensate the people, you have to provide the adequate environment to be able to test. Yes. These things run in the millions.
Right.
Yes. That's why you usually have a lot of pharmaceutical companies, big pharma, sponsoring these processes.
Right.
Yes, because it's very, very capital intensive. Yeah.
$5 million.
Yes. Do you have $5 million for me?
Well, I'm sure I'm actually hoping that some of our viewers are able to support. And actually, that's one very interesting thing I'm hoping to achieve with this very interview, because your story is very inspiring. For someone who could have been anything she wanted, considering how smart you are and how intelligent you are, you decided to actually focus on humanity and to help. I mean, it gives me the impression that with some support, a lot of good can come to Ghana through you and through a lot of others.
Yes.
So, okay, how much of that do you have now, though?
None.
Take the 1,500 out.
So, I have had funding from other people's governments.
Okay.
Which is running out. So
other governments have seen the relevance of your research to the extent that they are pumping money into it.
Yes.
But not our government.
Not our government, yes. So, and that is the situation for a lot of researchers in Ghana. We actually have to look outside the country for funding, yes.
Right.
So sometimes the US government, Canadian government, UK government, yes. I have some researcher friends who, because of the COVID
Right.
and then the economic crunch they
Right.
came with, they had their funding cut off
Yeah,
because those governments are also reducing their research budgets.
true,
Yes.
true.
So I have had funding in the past. The most active one currently runs out in November. Yes. So you technically can say I have no money at this point.
Interesting. So we don't have money, for those of you watching. There's no money, except that Priscilla is embarking on something which has the potential to change lives, to transform a lot of lives. And for a number of you, you may not have seen an epileptic child before, or even someone who may be a little older, maybe suffering from epilepsy. It's not a very pleasant thing. It's quite challenging. And so for her to actually dedicate her life to trying to solve this, I think she deserves a bit more of our attention than we are currently giving her. And the good thing is that, well, you can help if you choose to. If you're watching this, and I'm sure a number of people in the diaspora usually watch 21 Minutes with KKB, so it's good you are watching this and you have the opportunity to help her. Priscilla, if anybody wants to help, how are they able to reach out to you?
So the easiest means of reaching me is by sending an email. Yes.
Okay.
So usually when people want to collaborate, they just send an email. I can put my email out there.
Sure, go ahead. You can just look into that camera.
Okay, so PK Mante, PKMANTE.farm@knust.edu.gh. Yes. One of the easiest ways is also, if you can't remember the email, you can just go to the KNUST website.
Okay.
Look through the staff profiles. If you search for me, it gives you the option to send me an email. It will come.
Okay. Dr. Priscilla Kolibea Mante. She's not someone you would see or hear about often, or even see on this platform quite a lot, because oftentimes we do a lot of political, current affairs related stuff, but she's doing something very amazing, and today we decided to throw the spotlight on her. This particular season of 21 Minutes with KKB is going to focus on a lot more of these. Yes, we've heard a lot of the talk, the politicals. Yeah, we've heard it. Let's try and change some perceptions. Let's try and improve lives. Let's try and make things better for you and I. So for those of you who have heard the email address, you've watched it, you've seen the interview, you've seen all the things. She's not going to use the money for clubbing. That one she already has it. We need money for the research. Well, as of now, we are in need of $5 million, you say, $5 million to help us come up with a cure, a possible cure for epilepsy. It may not be of interest to you now, but who knows what the next few years holds. You may have a child and then anything can happen. And so please, help if you can. If you are with an agency or you have contacts to an agency, just pass this video on and share the contact details, and you'll be helping millions of people who are currently suffering from this condition. But that's it. Thank you for watching. It's another episode of 21 Minutes with KKB. My name is Kwame. I'll see you soon again, hopefully with another guest you expect.